As always, we like to start our calls out with a message from our hospital executive director, Christine Klechter. Welcome, Christine.
Thanks, Jim, and thank you, veterans, for joining us today. Since our last town hall, we've had some exciting developments. This summer, we opened 2 brand new clinics. Our new Baraboo VA clinic is about a mile from the old location next to Anytime Fitness at 414 State Road 136. The previous location is no longer open, and all staff and resources can be found at the new clinic, which doubled the size of our old clinic. If you couldn't make it to our open house, please stop by. It's stunning. Also note that not all GPS or search engines have the updated address, so always refer to our official va.gov website for the most accurate information. That location again is 414 State Road 136 in Baraboo. We also opened our highly anticipated Madison East VA Clinic at 4904 East Park Boulevard, which is a new location and more convenient for those living near the east side of Madison. It offers primary care, women's health care, a brand new physical therapy gym, occupational therapy, nutrition, and whole health services, including a culinary classroom, mental health, telehealth, and a blood draw laboratory. We cannot be more excited to provide these services in areas where we have so many veterans who can utilize them. If you have a friend who isn't receiving their health care at VA, I encourage you to share your experiences with them so that they can receive the best veterans health care available. In fact, if you are interested or know someone who may be interested, stop by our open house at the Madison East VA Clinic tomorrow, September 19th, from 12 to 4 o'clock p.m. Again, that's tomorrow, Thursday, September 19th, from 12 o'clock to 4 p.m. at our new East Clinic located at 4904 East Park Boulevard. We look forward to seeing you there.
Thanks, Christine. And we hope to see many of you out there tomorrow at the open house at the East Clinic. And also to repeat what Christine said, we do not operate the third-party GPS apps on your phone or even the online search engines like Google or Bing. So the new addresses may not be accurate when you search for them on some apps or websites. As with anything these days, though, we encourage you to go directly to the source for accurate, updated information, which you can find on our va.gov websites. As we expand our services and resources to provide you with better access to care, one additional option we offer that we want to make sure all veterans are aware of is telehealth. For those who may not be aware of telehealth, or if you have concerns about using it, we have our telehealth program manager, Natalie Hart, here with us today to talk about our services and how we can help you remotely.
Thank you, Jim. VA telehealth has expanded greatly in recent years and makes it easier for you to obtain the health care you need without having to drive into Madison. I want to share a few options that you may find convenient, and it can save you time and travel. Telehealth allows you to see your health care provider without going into their office. All of our clinics offer real-time video telehealth, which brings specialty staff and services closer to your home. For example, you may live in Baraboo but need to see your provider in Madison. Rather than traveling to Madison, you can use telehealth equipment at the Baraboo Clinic. Providers can still make diagnoses, manage care, and perform checkups virtually without you having to travel to Madison. Some of the specialties include audiology, mental health, move, nutrition, geriatrics, epilepsy, and hematology. Your primary care provider can also consult with certain Madison specialists via telehealth. Along with having video visits with your provider, we can take images and complete testing at your local clinic with telehealth staff who can send the images and test results to your medical record so a specialty provider can review them. You can also receive some care in the privacy of your own home using VA Video Connect, which enables veterans to virtually meet with their VA healthcare providers. The video is encrypted to ensure the session is secure and private. It allows you to see and talk to your healthcare team from anywhere, including the comfort of your own home, making the VA healthcare more convenient and reducing travel times for veterans. You can also take advantage of group sessions using VA Video Connect, such as our GeroFit and Move programs. If you don't have internet service or the needed device to take advantage of telehealth, your VA provider can refer you to determine whether you are eligible for programs that can help you get the internet service or technology needed for VA telehealth through the Digital Divide Consult. Again, ask your provider for information about the Digital Divide Consult and ask them how you can benefit from telehealth. For more information about telehealth or to see if you're a good candidate to use it, talk to your healthcare provider.
Excellent. Thanks, Natalie. Before we move to our next presenter, we do want to ask a few polling questions. You'll use your phone keys on your phone to enter your answer. And our first question is, have you previously used telehealth for your appointment needs? Press 1 if yes, press 2 if no, press 3 if you're unsure. Again, using your phone keys, the polling question is, have you previously used telehealth for your appointment needs? Press 1 if yes, 2 if no, and press 3 if you're unsure. And we appreciate your answers. It's looking like right around 60% of you have not used telehealth. About 35% have. So we hope that the information that Natalie shared will introduce you more so to telehealth, should you want to use that, and it's possible to use in the future. Next question is, based on what Natalie did share with you about telehealth, are you more likely or less likely to use it? Press 1 if you're more likely, press 2 if you're less likely, press 3 if you're unsure. That question, again, is based on what Natalie shared with you about telehealth. Are you more likely or less likely to use it? Using your phone keys, press 1 if you're more likely, press 2 if you're less likely, and press 3 if you're unsure. Looks like just shy of 50% of you are more likely to use it. 2 are less likely, which is perfectly fine. 34 unsure. So I would say keep that in mind for your future appointments and talk to your healthcare provider to see if telehealth might be an option for you. Thank you for participating. We know you've been hearing a lot about PACT Act and certainly hope you've taken full advantage of this explanation, of this expansion of benefits, or at least told your friends all about it. Here to talk about that expansion is our Chief of Health Administration Services, Liana Torres.
Good afternoon. As you may know, since March 5th of 2024, veterans exposed to toxins and other hazards while serving our country are eligible to enroll directly in VA healthcare without first applying for VA benefits as part of the PACT Act. Veterans who believe they were exposed to burn tips, Agent Orange, chemicals, nuclear weapons, or other toxins while serving may be eligible. It also includes veterans who were never deployed or were exposed to toxins or other hazards while training or on active duty here at home through their work with chemicals, pesticides, lead, asbestos, certain paints, nuclear weapons, X-rays, and more. Many veterans hesitate to reach out to VA if they don't have immediate health concerns, but it is important for them to get established now before they need the care. Since August 10, 2022, I think we've enrolled 421,000 veterans in VA healthcare, with 161,706 of those enrollments exclusively due to the PACT Act authority. Thanks to the PACT Act, more than 800,000 veterans not eligible for VA care due to income have received a priority group upgrade and now eligible to receive care at the VA. Nearly 5.7 million veterans have been screened for toxic exposures, with more screenings done daily. There are many veterans who don't receive their care at the VA, opting for other options. We encourage you to share the care and suggest those veterans to reach out to VA for their healthcare needs and to get established earlier rather than later, so we can provide the best care possible when veterans need it. We're actively encouraging all veterans, don't wait. Apply for the care you deserve at va.gov/PACT and choose VA as your trusted provider. Please encourage your fellow veterans to do the same. Again, that is va.gov/PACT. Thank you.
Thanks, Liana. Before we move on to our next presenter, we again want to ask a polling question. You'll use your phone keypad like you did before to enter your answer. That question is, have you looked into your benefits recently because of the PACT Act to ensure you are taking advantage of all of your benefits? Press 1 if yes. Press 2 if no. Whoops, I forgot to start the question. There we go. Again, that question is, have you looked into your benefits recently because of the PACT Act to ensure you are taking advantage of all your benefits? Press 1 if yes. Press 2 if no. And we're getting answers in. Looks like about 80% of you have not looked into it lately. So we, as Liana said, we highly encourage you to look into the benefits. There may be situations in the past where may not have been approved for coverage that you might be approved now. So that website again is va.gov/PACT, P-A-C-T. September is Suicide Prevention Month with the Don't Wait, Reach Out campaign. Here to tell us more is our Suicide Prevention Coordinator, Andrea Bailey.
Hello, and thank you for being on this call. At VA, our highest clinical priority is to prevent veteran suicide. While September is designated as Suicide Prevention Month, all year long we want to acknowledge that difficult life events, such as employment struggles, financial pressures, health challenges, or relationship problems, can increase a person's risk for suicide. It's important and takes bravery to reach out for support when you need it, but there is hope. Veterans are often the first to help others, but it can sometimes be hard to ask for help or accept it for yourself. So if you or another veteran you know are struggling, don't wait, reach out. Visit va.gov/reach, R-E-A-C-H, for resources today. The VA can help veterans who are facing difficulties coping with their stress before it becomes overwhelming. That resource again is va.gov/reach. Tragically, our nation's veterans are at higher risk for suicide compared to the general population, and we believe that everyone plays a role in suicide prevention. Veterans, it's okay to ask for help. Reaching out for support when you need it is brave and important. If you find yourself in crisis or are concerned about another veteran in crisis, please contact the Veterans Crisis Line to receive 24/7 confidential support. Enrollment in VA benefits or health care are not required to access the Veterans Crisis Line. You can reach responders 3 ways. Dial 988, then press 1, or chat online at veteranscrisisline.net/chat, or you can send a text to 838-255. Again, you can reach responders 3 ways. Dial 988, then press 1, or chat online at veteranscrisisline.net/chat, or send a text to 383-255.
And we'd like to pause for a moment before Andrea finishes up for our last polling questions of today. Again, you'll use your phone keypad to enter your answer. Our next question is, do you know of someone who has thought about or died by suicide? Press 1 if yes. Press 2 if no. Again, do you know of someone who has thought about suicide or who has died by suicide? Press 1 if yes. Press 2 if no. So it looks like 55% of you do not know someone that you're aware of, so that is positive. 45% of people do, and I think many people come across folks in every walk of life. So it's good to keep all of these resources in mind. Our next question is, have you either stored 988 in your phones, or are you prepared to use 988 for yourselves or for a fellow veteran? Press 1 if yes, press 2 if no. Again, have you either stored 988 in your phones, or are you prepared to use 988 for yourselves or your fellow veteran? Press 1 if yes, press 2 if no. Looks like about 70% said no, so we hope that if you don't remember anything else today, that you remember that 988 number to be able to share or to use if you need.
Thank you so much. As you can tell from this small sample, we all have a job to help one another, and suicide is preventable. Thank you for your service. We're proud to serve you through any difficult life challenges. Remember, don't wait, reach out, and save 988 to your phone.
Thanks, Andrea, and thank you, veterans on the call, for being willing to answer these difficult questions and being willing to help your fellow veterans. It's the time of year when we start discussing flu vaccines. It's important to get a flu shot to protect yourself and those around you. All veterans enrolled in VA healthcare may get a free flu shot at their nearest VA healthcare facility. Beginning October 1st, so in just shy of 2 weeks, veterans can receive their flu vaccine by calling the clinic, your local clinic where you receive primary care, to schedule an appointment, or you can walk in at the main hospital. You can stop by our flu table Monday through Friday between 8 and 3:30. Again, that's starting October 1st. Flu vaccines will be available. You can schedule an appointment at the clinic where you receive care, or you can walk into the hospital between 8 a.m. and 3:30 p.m. for your flu vaccines. We're also anticipating the updated 2024-2025 COVID vaccine to be available at that time as well, and it is safe for you to get both at the same time should you choose to do so. And now it's time to move into the question and answer portion of our program. We have several questions in our queue, and we'll call your name when we are ready for your question. We can see your questions on our screen, but we do ask for you to repeat the question so that others on the call are able to hear it and are able to respond. It looks like our first question is from here in Wisconsin. It's Jeffrey in Wisconsin. Jeffrey, go ahead with your question. Jeffrey, are you on the line?
Yeah.
Hi, Jeffrey. Go ahead with your question.
Is this for Jeff Prohaska?
Yes.
Does it have to do with fish oil? Okay. The reason I'm asking, I've been told fish oil is no longer prescribable or can no longer be refilled, but I was not told if I'm to keep taking it or not. So I was wondering if I'm supposed to keep taking it. The doctor said they knew nothing about it.
Hi, Jeff. This is Dr. Holly Eisenhower. I'm the Assistant Chief of Primary Care here, and I'm also a PACT provider. What I wanted to let you know regarding your question is that the National Pharmacy Benefit Manager for the VA made the decision to no longer continue to supply fish oil, and they were citing clinical studies that show that it didn't have a significant benefit to veterans and non-veterans.
I understand that.
Of course, no. It's reasonable to call. And what I was going to suggest, if you do have questions about the condition that you had, that the fish oil was being prescribed for, that you go back and contact your PACT team so you two can develop a plan together on how to move forward.
No, everything is fine because, like I say, the reason I was prescribed fish oil approximately 8 years ago because I had high cholesterol. But for the last 3 years, my cholesterol is a very excellent, the doctor told me, at an excellent pace or size or whatever you're supposed to say, the numbers anyway. So they're excellent. Due to the fact that you're walking and you're taking your simvastatin.
That's great news.
So that's why I said I was wondering, I hadn't heard if I was supposed to keep taking that or not. I felt I wouldn't have to, but just didn't know.
For sure. I would suggest continue that conversation with your PACS team, but again, the fish oil won't be available any further, and that was due to because current clinical evidence didn't show a significant benefit. Not harm, but it just didn't show a benefit.
Yeah, it'd be no problem because when I'm obtaining it, because approximately 6 months ago, for 2 months, I wasn't able to obtain it. I had to buy it over the counter. But that's what I'd have to do now, is just get it over the counter, and I don't have to take that much a day or anything like that. So it'd be no problem whatsoever.
I'm glad to hear that. I hope you have a great day. Thanks for calling.
Okay, thank you for the answer.
Thank you, Jeffrey. Our next question, we're going to Jefferson. Mr. Ken in Jefferson, you have a question for us. Go ahead.
Yes, I was wondering if the VA hospital if they do hip and knee replacements.
Hey, this is Dr. Marsh. I'm the chief of staff here. So absolutely we do. We do both. And you just need to reach out to your primary care provider to get a consult to our wonderful orthopedic surgery group, and they can take a look at you.
Excellent. Does that answer your question, Ken? We're having some technical difficulties. We'll go to our next caller, and that is going to be, actually, we do have a question in the queue that is from an unknown person, so we can't call on you since we don't have your name, but the question looks like the veteran transferred not long ago from Lovell, so welcome to Madison. He said he or she is getting some dental work from Community Care to Monroe, Wisconsin. How do I get my records sent?
Hi, this is Liana Torres. I'm the Chief of Health Administration Services, and we, under our purview, we have the Release of Information Department. Any veteran that is referred to a community provider from the VA will get the records that are necessary for the referral sent to that provider. And if you are using your private insurance to see a community provider and they need any records from the VA, they can send a referral, a request to the VA for those records to the number 608-830-6655, and that is again 608-830-6655 for the Release of Information Department to send those records back to the provider.
Excellent.
Thank you.
Thanks, Liana. And Jeff, who asked our first question, we're having some technical difficulties on our end, and we cannot disconnect you, and we don't want you to hang up, but if we can ask you to mute your phone, we would be very appreciative. Our next question is going to be Todd. How do I say that? I'm Poinet. I'm new to Wisconsin. So Todd in Poinet, go ahead with your question.
Hi, can you hear me?
We sure can. Go ahead.
So using the BTSSS, the Benefit Travel Self-Service System, there are times that when you log on, it takes 10 minutes, 30 minutes, where it times out several times every day when trying to input your appointment and then claim the mileage for the appointment. Community Care doesn't put any of those appointments in at that time. I I have made mistakes on facilities and have to call to get it corrected. Is there anybody looking into why the system is so slow, or if there's a better way to file for travel? Because you always have to have a proof that you completed your community care appointment. I finally got all of my community care providers trained well enough that I can get some sort of slip from them, but that was a problem in the beginning as well.
Hey, Tom, my name's Kent Hall. I'm the Associate Chief of the Health Administration Services. So I do work closely with the travel department, and when it comes to our community care appointment, it is a little bit more complex because we do require, the records to be inside there. But as far as the system difficulties and technicalities, it is unfortunate. We do ask people to be vigilant when it comes to the system. Thankfully, you do get 30 days to be able to complete these submissions, and anytime a submission is put in and not completed, the travel staff are aware of it. They come up as incomplete and are able to investigate it a little bit further. As far as system updates, they're constantly trying to make updates to this system, and again, our staff is trying to help out as much as we can. But if you do have questions in regards to submissions, or whether it's community care or even the first party submissions, we do ask for you to give us a call, and the number is 608-256-1901, and the extension for the travel department is 11919. I do want to give you the number again. It is 608-256-1901, extension 11919. We do also have another option that could be a little bit more beneficial for you. If you do use your My Healthy Vet regularly, you can reach out to the Madison Travel Department, and if you need to upload your records there, you can do that, and they can also assist you with submitting those appointments.
As far as calling that extension 119, whatever it was, I got it written down. It's in my phone. But it always goes to voicemail, and they always say, well, we'll get back to you in 48 hours. Well, you get busy and stuff like that. I've had a couple of them fall beyond the 30-day wayside simply because, trying to get things fixed or whatever. So, that's something that definitely needs to be looked into on a better way of getting, maybe at least just getting the appointments into the system.
So, Todd, this is Liana. I am the chief of the service, and what I can advise you is when you have multiple appointments with a community care referral, is that you can get your proof of appointment right when you have your appointment, and you can submit your claim with that proof of appointment, and that could expedite the payment. However, because of the way the system is set up, it will always require a manual review from the staff because the referral can only hold one appointment, which is the initial one, which is unfortunate, but it is a flaw of the system. So I do appreciate your patience with it, though. Thank you for your question.
Excellent. Thanks, Liana. Thanks, Ken. Our next question is going to be from Thomas in Lake Geneva, Wisconsin. Thomas, go ahead with your question.
Good afternoon. How are you?
Fantastic. How are you?
Well, I could be better, but I'm working on it. I've been going to the Hines VA down in Chicago for 20 years or so, and recently I started going to a chiropractor because I have a bad back. It's been looked at by the Hines people, I don't know, maybe 4 or 5 times. They've taken x-rays and CAD x-rays and just had an MRI done on Monday. And they're telling me that via the MRI results that my back is deteriorating since the last one. So they, want to send me up to a neurologist to have him do an evaluation. The problem is the neurologists are booked up well past 30 days. So now they're sending me over to community care to see if they can find one that's willing to do the evaluation outside the VA system. And I looked and I saw that the Madison Hospital, the University Hospital, is associated with the local VA in Madison. There's also, I go to a chiropractor who's working on my back, and he started to give me some insight on a procedure called MILD, M-I-L-D. And I looked it up on the internet, and it's minimum, it's not very invasive. It's done as an outpatient situation. And according to the articles I've read, it's quite effective on reducing pain in one's lower back. So I've talked to my primary care physician about that, and that's why I ended up getting the MRI. They wanted to see how bad my back is going. And now they're looking for an evaluation doctor, a neurologist someplace to do an evaluation. But I also researched the MILD procedure, and there is a doctor at the University Hospital that performs that procedure. And there's also one here locally at Lake Geneva in a pain clinic.
Yeah, hey, Thomas, this is Dr. Marsh, the Chief of Staff. So, sorry you're having the pain in your back. I know that's incredibly difficult. So, while we are physically connected to the University Hospital, we have to go through the usual community care mechanism that Hines would have to go through, or our primary care providers would have to go through to see if they could get that procedure done for you. So that would be something absolutely to discuss with your primary doctor to see if that's something that might be an option.
Awesome. Thank you, Thomas. Hang in there. Back pain is never fun. Our next question is going to be Scott in Big Flats, Wisconsin. Scott in Big Flats, go ahead with your question.
My question is that I need dental work done, and I was told when I went to Toma VA, I had to go there for something else, that they said, yeah, the VA does dental work. And then I was told that they only do dental work on military men and women that are disabled. I'm not disabled. Well, I am, but I'm not from the VA, though. My question, I was wondering if there is a thing that says that only veterans that are disabled can go to the VA in Toma to see the dentist there.
Hi, Scott. My name is Stephanie. I'm the Chief of Social Work here at the Madison VA. And I just want to say thank you for raising this question, because it is a question that we get very often, because we have a lot of veterans, just like the general public, that need dental care. Unfortunately, in the VA system, dental care is based off of some pretty strict guidelines that are set by law. And so each facility has to follow those rules about the eligibility on dental care and who we can provide dental care for. Now, it's strict and it's pretty narrow, but there are quite a few people that may be eligible for dental care and they just don't know it. But you're correct in saying a veteran who is highly service-connected at the 100% level is going to be able to get dental care through the VA. But there are other eligibility categories, so I think it's important for you to talk to your primary care provider and have them put in a consult to see if you are eligible for dental care. That way you'll know for sure whether you're eligible or not. Then, if you're not eligible, you'll want to perhaps talk to a social worker at wherever you get primary care about some low-income dental resources that are available to every citizen in the community, whether you're a veteran or not. So I would encourage you to first talk to your primary care provider, see if you're eligible, and if you're not, then try to get with the social worker where your primary care is, if that's up at Toma, through Toma, and they can probably help you with some low-cost dental options. Thank you.
Thanks, Scott. Thanks, Stephanie. Our next question is going to be from Michelle in Wisconsin Rapids. Michelle, you have a question about telehealth.
I do. Does the telehealth cover all of Wisconsin, or is just that certain areas based on your residency?
Hi, Michelle. My name is Natalie. I'm the telehealth program manager here. Both Madison and Toma providers do offer telehealth all over the state. We offer many through Toma as well. I see you're from Wisconsin Rapids. There is a clinic there. Madison specialty providers do provide services like hematology, cardiology, renal, epilepsy, diabetes, and geriatrics to that clinic specifically, along with the rest of the outpatient clinics for Toma. I did check with my counterpart in Toma, who would be over Wisconsin Rapids. She indicated telehealth services are available from Toma providers. Those include mental health, endocrine, diabetes, and teleretinal imaging. Do you have any follow-up questions on telehealth?
I do, actually. So the veteran is moving from Whitewater, which is currently under Madison Care, to the Wisconsin Rapids area, which then, regarding the telehealth, could we stay with Madison, or do we have to transfer primary care to Toma based on the geographical region of where we live?
This is Stephanie from Social Work. I have a couple of comments about that. I think it's really important to look at this specific situation to determine what is more advantageous. It really depends on if you're looking for travel eligibility, if you're looking for mileage reimbursement. And so I think in particular, you'd want to perhaps call, and you can call Social Work, and we can help you look at the pros and cons to each individual situation and what kind of services you have or need and where it might be best to get that. So I'm going to give you our phone number. It's area code 608-280-7085. That's 608-280-7085. And we can discuss the individual situation. Thank you.
Thanks for your question, Michelle, and the answers, Natalie and Stephanie. Our next question, we're going to Rockford. Junior in Rockford. Junior, you have a question about the Rockford Clinic. Go ahead.
Yes, I do. I think the Rockford Clinic is fantastic, but I've talked to my primary in the past, and they told me that perhaps they might expand their areas of availability in the Rockford area. And I was curious if the VA had plans for any future improvements at that clinic.
Hi, Junior. This is Abe. I'm the Associate Director. And as Jim alluded to earlier, we did have 2 recent expansions of care for Baraboo and our brand new clinic at East. I can confirm that we do have future plans for expansions in Freeport and for Rockford. So we're very excited about that. We're very happy you're getting your care in Rockford. The plans for actualizing an expansion usually take a little bit of time. But I can tell you that we're actively looking at that, and the more veterans that go to Rockford and seek care there, the more emphasis that we have on making sure that we're delivering services to veterans in the Rockford area. So thanks for your question, and keep your ears open for future information on those expansion plans.
Thanks, Junior. And we agree. We think our Rockford Clinic staff's pretty awesome, too. So we appreciate the compliment. Our next question is Jeffrey in Milwaukee. Jeffrey, go ahead with your question. Jeffrey in Milwaukee. You had a question about care?
Yes. Good afternoon. I'm sitting here listening to all the questions. I kind of formulated an answer to my own questions, but I'll run it by you anyway. So for the PACT Act, I finally got my examination through an community outsource, and I missed my appointment by an hour. So I imagine I have to start the process over. My lungs are relatively healthy. So do I have to start the process over? And do most of the people who get disability from the PACT Act have reduced function of their pulmonary status?
Hey, Jeffrey, this is Dr. Marsh, Chief of Staff here. So thank you for your service, and it sounds like certainly a frustration that appointment was missed. I suspect you will have to get a new appointment with that. With that said, it's a broad question of do people have reduced lung function? I think it's going to be variable. Certainly there are some that have taken sustained damage to their lungs and some that haven't. So that's going to be something that they can explore with you when you're seen.
Have a good afternoon.
Thank you. Yeah, we always tell veterans, please be screened now. We'd much rather you get screened and not need the help, but at least have all your information in our system so that 10, 20 years down the road, if you do need to get health care, we have a record that you've been screened and have your information ready to go. So our next question, we're going to Bill in Marengo, Illinois. Bill, go ahead with your question about community care.
Yes, how do I get community care? Do I have to go to the VA clinic first to get it?
Hi, Bill. This is Melissa. I'm the Chief of Community Care here at Madison. And yes, so there's eligibility requirements for community care. The most frequent ones that make veterans eligible are drive time, wait time, or because the VA doesn't offer that service. But in order to find out your eligibility, yes, you should reach out to your VA primary care provider, and they will be able to enter the consults for that care that's needed, whether that is done through the VA or if you were eligible and chose your care in the community, they would process that through our community care department.
Excellent. Thanks for your question, Bill. Our next question is Kenneth in Reedsburg. Kenneth in Reedsburg, go ahead with your question.
Yeah, I'm getting my service in Baraboo, but now I used to be able to request a renewal of my prescription by sending a message through the My Healthy Vet website to my primary provider. Now they're requiring I have to call the pharmacy in Madison, but I can't always get through. I'm not. This is not throwing shade at your pharmacy, but it's just a technical difficulty, and I would like to be able to just send a message to Dr. Sauvé and have her renew my prescription.
Hi, Kenneth. I thought I knew the answer to your question, and then you started having, it sounds like, what are technical difficulties. But this is Stephanie from Social Work. I know a little bit about prescription renewals. What I would say is that I wonder if you're having technical difficulties in the My Healthy Vet program, and maybe there's a problem with your premium account. And so what maybe I would suggest to do is to call the help desk, and I can give you that phone number, and they might be able to help you because you really should be able to do it through your premium account on My Healthy Vet. And maybe there was some sort of upgrade or glitch that just isn't making it happen. Obviously, that's for prescription refills, and for the renewals for the prescription, if you don't have refills any left, that would be a secure message to your provider, Dr. Sauvé. So I'm going to give you the My Healthy Vet help desk number. It's 1-877-327-0022. Again, 877-327-0022. And again, I would get some tech support because it is much easier to do it through My Healthy Vet than try to get somebody on the phone. Thank you.
Thank you for that question, Kenneth. You also have an opportunity at the end of the call to leave a voicemail. If you want to, feel free to leave your number there, and I can follow up just in case it isn't My Healthy Vet. We can make sure you're taken care of. Our next question, we're going back to Illinois and Rockford. Ken in Rockford, go ahead with your question.
Yes, I'm a veteran, Marine Corps, and I just wanted to call and let people know that are listening that on August the 19th, I was up at the Madison VA and had a hip replacement. And I just wanted to call and thank everybody for what they did up there. Everything went well. They couldn't have been any nicer. They couldn't have been any more efficient. Everything is going well. And am I on the line?
You sure are.
Okay. It was so quiet, I didn't know if anybody's there. But I do go to my therapy at the VA here in Rockford, and I have to say I've been going there for years. Very nice people, very well run, no complaints. I just wanted somebody to know that my surgery went well, and those people were just wonderful up there. The surgeons, the nurses, all the staff, everybody was great, and I just want to thank everybody.
Excellent. Thank you, Ken. We appreciate that. Glad to hear things are going well. Thank you for your service in the Marine Corps, and we will be sure to pass that information and that compliment on to Rockford. We appreciate those positive comments. We actually have a trust score of all of our facilities of about 94% of our veterans trust us with their health care. So it's something we take a great deal of pride in, and we're glad that 94% trust us. We're working on the other 6. So thank you for your kind words. Our next question is going to be right here in Madison, in our own backyard. Adam in Madison. Adam, go ahead with your question.
Hey, I actually have 2 questions. One's regarding employment with the VA. I've been interested for a little time now about being a police officer for the VA here in Madison. And I was wondering if you guys had any insights on the hiring freeze and when that's going to end.
Well, Adam, this is Christine Kleckner. I'm the executive director. Just want to have a little bit of clarification. We actually are not in a hiring freeze.
Okay.
We have a little bit of background. Since 2019, we have had significant growth in our staffing levels. And I mean, and it's true to the great staff that we have here. I mean, we had to address so many issues like a pandemic, expansion of the PACT Act, but we have experienced significant growth. So we're not hiring at the same level as we previously were, but we do continue to fill positions. We just have to carefully look at our needs. We grew so fast that now it's time that we have to step back and really look at efficiencies, cost savings opportunities, and really make sure that we have the staff where we need to have the staff. Because what's happened as a nation, our Veterans Health Administration has overhired. And our budget will not support the high rates that had been hired. So that's what we're all feeling a little bit right now. But I want you to know that I don't really want veterans to be feeling that, because we're really working as an organization, again, as I said, to look for all the efficiencies and wherever we can do cost savings. We continually look at expanding services. We continue to look at here in the community. Actually, Madison does a great job keeping our numbers down in that area. We want to provide as much care as we can here in the hospital. So I just want you to have an understanding of that. Overall, we're way ahead with the actual staffing growth that we've had since 2019. But to address your specific question, we are continuing to fill vacancies in police positions. So, continue, to apply. But yes, we still have to hire. We are a hospital, but we're just very closely looking at where we're hiring. It's just kind of a strategic process, but
Hopefully that answers your question.
Thanks, Christine. Adam, did you say you had? Cut him off. Sorry about that, Adam. I think you may have mentioned that you had 2 questions, and we sent you back to the call. But again, you'll have an opportunity at the end of the call to leave a voicemail. So be sure to leave that, and we'll make sure somebody gets back to you. Our next question is Kevin in Oxford. Kevin in Oxford, go ahead with your question.
Hi, I was just wondering, what do I have to do to transfer from Toma to Baraboo?
Hi, Kevin. This is Stephanie, the Chief of Social Work. When you want to change your primary care from one VA to the other, thankfully Baraboo to Toma is within Vision 12, and so what I would recommend is that you contact your primary care provider and ask them to put in a consult for interfacility transfer for primary care. And if that doesn't work, then the primary care provider can explain a different way to do it. But I believe it's a consult that we can place to the Toma VA.
Excellent. Thanks, Kevin. We look forward to having you in our catchment area officially, hopefully. That's all the time we have for questions. We appreciate everybody who stayed on the line and those who had questions. Just a reminder, if we didn't get to your question, and it looks like that there are still a few of you in the queue, you're welcome to leave a voicemail with your questions, comments, or feedback, and we'll have somebody contact you. It may take a couple days, but we will certainly get back to you here as quickly as we can. Also, don't forget that our Madison East VA Clinic has an open house tomorrow from 12 to 4, so stop by and see us, and you might get your question answered quicker if you show up there. But stop by and say hi. And thank you for joining us. Again, please leave a voicemail if we didn't get your question, and we'll get you an answer as soon as we can. We look forward to talking to you again. Again, happy birthday to our Air Force veterans. Thank you for your service, and have a good rest of the day.